Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Complications of malnutrition. Number 2, hypothermia. In hypothermia is seen if the rectal temperature is less than 35.5 degrees Celsius or if axillary temperature is less than 35 degrees Celsius. In hypothermia, we will have to check the blood glucose levels, and temperature checking is also done every 2 hourly along with slow rewarming, and frequent small meals are also prescribed. So here, temperature checking should be done every 2 hourly with slow rewarming and frequent small meals.
thank you and thank you for watching.